Hi everybody, I'm Tash.
And I'm Damo.
And together we are so excited to bring you this week's episode of The Barry Chronicles.
This week, talking
Yes.
to Dr. Roy Hopkins.
I'm so excited for this. I cannot wait to talk to Dr. Roy.
Let's get to it. Hi everyone, so we're here with Dr. Roy Hopkins. He is all the way from New South Wales. And we're so happy to have you on the Barry Chronicles.
Thank you.
Thank you so much.
Dr. Roy, would you like to just tell us a little bit about yourself? You're a bariatric surgeon and upper GI, I believe.
Yeah, I do both. The long story is I'm an upper GI and bariatric surgeon and general surgeon based in Sydney, but also look after some of the south coast of New South Wales. Kind of came to bariatrics the long way around. Originally, way back in the day, and you can probably hear my accent, in New Zealand, I was a science researcher. So I've actually got an honours degree in biochemistry, genetics and microbiology, and then a master's by thesis in genetics and biochemistry. So I kind of had all that background behind me. Then I did medicine, went through surgery, not really knowing what I wanted to do, and then stumbled on upper GI and bariatrics, and I loved it. And I did the Ansgoza program, and then I did a couple of years after that as well, honing skills in bariatrics, and I ended up going to the UK, two high-volume units, one to do cancer, and then ended up in Manchester, which is a huge unit, looks after all the public cancer, upper esophagogastric cancer, public bariatrics, and public complex benign upper GI work for Greater Manchester and a population of 3.5 million people. So it was a very busy year, a lot of good experience. And I came back. I'm based down at St George in Sydney, and in the southern part of Sydney, a little bit of the northern part of Sydney as well, and down the south coast.
Wow. That's an incredible start.
So what prompted the change? Like, what prompted you to go down that route? Had you always intended to go to medical school?
I think in the back of my mind I did. Yeah, I always liked medicine. I always liked the science, but working with people. Yeah, if you can say that. Yeah. It was the interaction between science and working with people and helping them that prompted me to go into medicine. And a couple of old family friends said they thought I'd be a good doctor. So and I really enjoyed it. And I thought I'd be happier doing that than being a full-time researcher.
Yep.
I am. I'm very happy with what I do.
Incredible.
So no, I really like it. And I think in terms of, I wanted to do other things through med school, like most other med students did. Lots of other variable things. At one stage I wanted to be a cardiologist, then a gastroenterologist, and then I found I was attracted to surgery. I was attracted to little projects, individual projects, you could say. Where you have a little problem, you make one discrete change, and in my case, an operation, I hope, and it makes a discrete change in that person and has a much better outcome for them. Yeah. It's a fixed point in time where you can improve their health. Wow. And I really liked that, and it's like little project management, and you get to see the fruits of that as well when they come in, hopefully, to my rooms and see me, and they're doing great.
Yeah, I imagine that would be very, very rewarding.
I think it is, and I think the bariatrics, it's the endorphins, it's the happiness that you get from seeing your patients improve their lives.
Yeah,
it's seeing someone come back to you 2 weeks, 3 months, 6 months, 9 months, later throughout the period of follow-up, and seeing the milestones they're achieving and how much they are improving their lives from basic things like I've stopped snoring and my partner's now getting a great sleep and I feel much better.
Yeah.
So I'm now able to walk. I feel great. I can now go with my kids for a run in the park or a cycle in the park, or I'm now bushwalking 5 kilometers. It's great.
Yeah.
The decrease in the medications. I'm off my antihypertensives. I've decreased my diabetic meds. It's the happiness and the fulfillment that you get from seeing these people change their lives. That's great.
Amazing. Something that I'm picking up is your focus seems to be on outcomes other than jumping on the scales and let's see.
I love it.
Yeah.
I absolutely love it. You haven't mentioned numbers at all.
And I
I
don't.
just love that.
I don't. I talk in concepts. We know we can shift a certain amount of weight off, but not everybody is the same. Not everybody has the same medical past history. Not everyone's going to have that same starting block or achieve the same. What I want them to do is improve the quality of their life. That's the most important
100%.
thing.
Yeah.
And usually that means decreasing the comorbidities associated with the weight comes hypertension, dyslipidemia, diabetes, and a range of other things, sleep apnea. And seeing them check those off one by one and really improving the quality of life is great. It's health enhancing surgery. It's giving people their lives back, giving them the quality of health back, but also then giving them quality of life back for them, their loved ones, and their families, and enriching their lives. And
I love health enhancing.
Yeah, me too.
There's people that are close to us that they've had weight loss surgery and they never got to their weight goal, but their quality of life improved. And it's sort of taken a long time for them to realize that, it was a good thing that I did because my quality of life is better, even though I never got to that magic number on the scales that was set for me,
Yeah.
I think people perseverate on a figure and they get focused on a figure and they beat themselves up if they don't get to that figure, and they beat themselves up if there's not a steady, constant motion towards that figure. Life's not like that.
Yeah.
Life has ups and downs. That's the human condition. We have stops, we have starts, we have hurdles, we have triumphs, and I could get all philosophical on you and say, to succeed without adversity is to triumph without glory. Everyone's going to have hurdles, and everyone's hurdles is going to be different. I have not walked a mile in any of my patients' shoes. I do not know what they've been through. My job is to work with them to improve their health.
Yeah.
And so everyone comes from a different starting point. But if you can try and get them towards a healthier place overall, then I'm doing what I should be doing.
Yeah, that's amazing.
Yeah.
So what are in your practice, what are the major or the main types of weight loss procedures or bariatric procedures that you're doing?
Primarily sleeve and a little bit of bypass.
Yeah.
I think it depends. There's no black and white answer for everybody, and that's for everything in life. That's what I tell my trainees. The true answer to everything is it depends. And there's different shades of grey. Not everything's black and white. So it depends what the goal of that person is. It depends how we think we're going to get there. It depends on what kind of lifestyle they lead as well. It depends where they live. I do quite a bit of work with people in non-metropolitan areas. And so I'm looking for something robust that isn't going to fail and is going to be sturdy and is going to be with them and competent for the long term, if you can say. Yeah. And so a lot of people in non-metropolitan areas, I tend to go towards the sleeve.
Yeah.
We know the bariatric surgery registry data is available. We know across Australia with Australian results, not results from overseas, but specific to Australia. I mean, the differences between a sleeve at a year is 31%, and one anastomosis bypass is 34%, and a bypass is 32%. There's not really a lot of difference. So it depends what the goal of that patient is, but it also depends what comorbidities they've got as well.
Yeah.
And what medications they're on. The different procedures have different ramifications for different medications as well. So I think it's really a personalized approach. It's using all my training, using all the knowledge I've got, and working with that patient as an individual, like an N=1, to work out a tailored approach for them and what is the best thing for them.
Yeah. Yeah, I totally see that.
I love that.
Sitting here, so I had a lap band 16 years ago, and of course then bypass was, and a long history of reflux. So then bypass is what was going to be probably the best choice for me. So that's what I ended up having. I had gastric bypass. Damo, on the other hand, well, he sleeved.
Okay, so the two of you had the major procedures, both of them, and you can compare and contrast as well.
Yeah.
Pros and cons to both. There are pros and cons to everything in life.
Yep, there absolutely are.
And it's working through, and also working through with the patient as an individual, what they are happy with.
Yeah.
I'm not going to tell them what they're going to have. I work with them. It's like sitting down and working through those ethical tenets of medicine. So autonomy, everyone can decide for themselves what they're going to do with their lives. Justice, doing the right thing for them. Beneficence, only trying to do good, and non-maleficence, not doing wrong to the patients, and working through them and working out what is going to be the best thing for them and what their thought process is, and actually actively listening to them about what their thought process is, and then unpacking it sometimes if you have to as well, depending on what information they've got, what sources they've been given, and where it's come from.
That's very
because what's right for one person isn't right for the other. It's not a sledgehammer approach. It's a lot more nuanced than that, and working through what's actually going to be best for each person. You could get a slightly older person who comes and wants a bypass, and you're like, well, no, you don't really want to lose that much weight because you don't have the ability to put muscle on anymore. Lots of little nuances like that.
Wow.
And young ladies who might want to fall pregnant, who might have other medical conditions. It's all a lot more nuanced than that, and it's picking the right thing. And I'll go back to unpacking. Sometimes I'm fascinated with unpacking the thought process about what they want and why they want it, and what has made them come to that conclusion before coming to see me or any other bariatric surgeon.
Do you find that there's a lot of sort of preconceived ideas about the different surgeries?
I think there's some preconceived ideas out there. Yeah. Not so much for me personally. No. I take the approach. I ask them what they're looking for to start off with.
Yeah.
And I have a good discussion with them. And I think more than anything, I emphasize this is a tool. This isn't a magic answer. This isn't a magical thing where I can wave a wand and they get better instantly. This is a tool, and there's different analogies to the tool. One of the ones I tend to use is a bit like a lawnmower. Sounds a bit weird, but you can buy any lawnmower out there. You can buy a little electric lawnmower, a petrol powered one. You can even buy a ride-on lawnmower. But why would you buy a ride-on lawnmower when you've only got a courtyard full of grass?
Yep.
Yeah.
And then it's like a tool. And then every tool needs to be maintained properly to work properly. But it's not just about maintaining the tool. It's about maintaining the tool within the environment. What kind of grass have you got? How big is it? Do you need to fertilize it? Do you want to keep it short to keep it lush? Do you want to keep it long? What is the concept that you're after? And it's making sure that they know it's a tool.
Yeah.
And by using the tool appropriately, it should serve them well for the rest of their lives. And for most people, it is. If you look at the bariatric surgery registry data, there's only about, I think the data shows less than 10% conversion rate. So
wow.
I was reading that the other day. And so if we pick the right thing for them and we know what they're trying to achieve, how they're going to achieve it, and then also that it will take maintenance from their part, that they need to be involved in it, that they need to be actively involved in what they're doing. And that's why I have a psychologist and a dietitian, like most of my colleagues. We know that if we use it as a holistic all-round package and we work with them, and there's the three of us working together as a team with the patient, so it's actually a team of four, including the patient, we can, if they move slightly to the right, we can move them. They go left. If they go off piste, we can drag them back onto the trail. It's all about, and then embedding those new behaviors, because that's what it is. Anytime you want to start something, anytime you want to start a new habit, it takes time to embed that habit in, whether it's a psychological habit, whether it's a sport habit, whether it's anything else, a new skill you want to learn. It takes time and practice, and you've got to work at it. And that's what you want to make sure. I want to check their engagement when they come to see me, that they do realize they've got to work at it. This isn't a simple answer. We give them a tool and we work with that tool. to change their lives. And if they've got a good tool, I'm hoping, good technician, we do a good operation and it works well and they work with me and my dietitian and my psychologist, we have great outcomes. But it's working together as a team. And that's the thing. And it's not just me, it's the team. It's the psychologist and the dietitian. I rely on them. I was very particular about who I chose to work with. I'm very happy with who I chose to work with because they've got great people skills. They have great rapport with the patients and they have a great understanding and experience. And I think if you work with the right people, I'm only as good as the team around me, let's be honest. So, if I have a good team, we have good outcomes. And that's the most important thing.
Yeah, I love that.
Yeah, it's brilliant. It's I love the analogies as well, and
I could use other ones, Damo, like a Thermomix, but maybe not. You can use a Thermomix. You can have the flashiest instrument, but if you only know how to heat and cool it and whiz it around, or if you understand it intricately, you can make masterpieces.
Yeah. I remember my grandmother actually bought a food processor back in the day, and it never got used because she was just like scared of it, and using that or not using the tool at all, and
we get from it what we're willing to put in, and how we're willing to work with it. I know one of the things that I love about being privileged enough to speak with surgeons like yourself and other great surgeons that are doing wonderful work across the country. Everybody has a very similar thought process and belief around the fact that it's a team effort.
Yeah.
And it requires a fantastic operation, the right choice for the person. But also it requires that psychological support and also the dietetic support in order to be able to optimize the results in the long term. And it's something that I hope our listeners will take on board and really understand is that it won't be a quick fix unless we're willing to put in that effort and that work.
Yeah, you're absolutely right. And it's the team approach.
Yeah.
And it's having the team working together so that we can flick each other a text or an email or call. And if there are any issues, we can get onto it as a team.
Yeah.
And work together as a team to get it fixed. And that's the most important thing.
Yeah. I love it because, quite often we hear where people will say that they're receiving different information from their dietitian to their surgeon and they're confused as to which one they should go with. And, it makes it so much easier for people when everyone's on the same page.
Yeah, absolutely. I can give you an example of that. Like I got a young patient who's had a sleeve and done very well, but he's wanting and probably will get back to playing semi-professional sport. He's doing great, but we're trying to change. We need to change his nutrition slightly because he's now in a power building phase for energy for his sport and muscle building. Muscle's different to fat. Muscle's got a different metabolism to fat. It's got a different mass to fat as well. So he's actively building muscle rather than losing the fat content. And so his weight and therefore his nutrition is going to be different to another person post-sleeve. But by talking to my dietitian, talking to him about it, and working together as a team, we just personalize his approach even more. And we work out what he needs in terms of nutrition and protein. And so
that's such an important topic, and it's one that comes up all the time on our support page constantly. No, I mean, obviously not always at an elite level, but just even for those people that are just really wanting to see probably a slightly better than average result in the gym, just how important that nutritional component is in that muscle building after bariatrics.
Yeah, absolutely. You've got different building blocks. You're trying to metabolize the adipose tissue, but at the same time, you're trying to lay down new protein and muscle, and you need different requirements for that.
Yeah.
And you need to be very cognizant of that, of what you're trying to achieve and how you're trying to achieve it, and tailor your diet specifically, or change your diet and work around it, and let us know that's what you're trying to achieve.
Yes.
It's you need to let, we work with you. I'll always work with my patients. I love my patients. I get on with them, and I want them to be the best that they want to be. I want them to be the person they want to be. And so I'll work with them. And if we need to change the approach, absolutely, we'll just tweak things. But it's better to know that that's what they want to achieve, so we can tweak things.
Yeah, that's right.
Yeah, and it's like everything in life. It's good communication. Having really good communication, open lines of communication between the patient, myself, psychologist, dietitian, and everyone within the team together as a network, it works much better, because then you can work together as a group to achieve the goals.
Yeah, I love that.
Yeah,
it's something that once you say it, it's so obvious, but quite often people, they start at the gym, but they haven't told their dietitian that that's what they're doing, and then suddenly I'm not losing weight and I don't know what's going on. And
a plateau's happened. Some, there's some sort of like they're not seeing the muscle building that they would have hoped to have seen, and all of those different things. That's where that communication just is so important, isn't it?
Yeah, and if you want to use another sporting analogy, you look at the British cycling team when they did so well at the Olympics. Sorry. It's aggregation of marginal gains. It's the small things that add up together that really make the big change. And so having a slightly different approach from the dietitian, having a slightly different approach from myself, having a slightly different approach from the psychologist, and then if we need to, even talking to the sports coach, if we need to tweak things around, getting really personal and working out the best individualized program for that person to achieve what they want to achieve.
Yeah.
And then you see them coming in, and this guy came in and he was just bouncing off the walls because he was doing well. He was getting placed in tournaments within a year of his bariatric surgery.
Wow.
That's just incredible.
I'm stoked for him.
Yeah.
I'm absolutely thrilled.
How life-changing is that?
Oh, yeah. But not only that, it's life-changing psychologically for him as well. It's given him additional motivation. And that is the other thing. It has turned his life around. And I'm thrilled beyond words for him.
Yeah, that's incredible. I imagine that part of it must just be so rewarding.
Oh, yeah. It's the little endorphins. It's the little happy high I get when I see that they're doing well.